my friends. So as you have started down this kind of accelerated path of reaching out to patients that have unscheduled treatment and unused dental benefits, I want to just dive in a little bit more as to case acceptance. I had a really great conversation a few weeks ago with Robin Smith from Henry Schein One. We talked about case acceptance because it came up on the Catalyst Index report that is put out by Jarvis every year. And so we talked a lot about case acceptance. And so I wanted to dive into that a little bit deeper as far as like, what does this number mean? Like, what is case acceptance? What's the definition of case acceptance? How do I manage it? Why should I care? And I wanted to just kind of answer some of those questions that I've been getting about, like, I don't even know what my case acceptance is. And, what is it exactly? And so let's just dive into some of those questions, and I can help you to identify where we even get that number from and how do we manage, our unscheduled treatment, and where do we actually get the case acceptance? So case acceptance comes from if treatment has been completed or if you feel that the treatment has been accepted. So, for example, my idea of accepted treatment would be if the patient is scheduled or if they have given you a deposit. So let's say, for example, the patient has a dental implant to do, dental implant crown, an implant surgery, implant crown, the whole thing for a single tooth. Let's just give a single tooth implant example. Now, let's say that you are treatment planning this single tooth dental implant for the patient. They're in your consult room, and you're presenting the surgery and the abutment and the crown and all of that. But let's say that you don't do the implant surgery. Let's say you're referring that out to a specialist. And so on your treatment plan, on the dental implant, you've treatment planned the implant surgery, but you're not actually performing the implant surgery. You're referring it out to a specialist. And so you've attached the referral, your oral surgeon or your periodontist, and you're referring that implant surgery out. And so it shows, of course, as a 0 line item on your treatment plan, but your doctor is performing the abutment, the crown, and the delivery of the crown and all of the final restoration. So you give this patient a treatment plan estimate. Let's say it's $2,500. And the implant surgery is going to be performed at another doctor, another specialist. And let's say the patient says, yes, I want to do the dental implant. How do we get started? And so you help the patient with, well, let's back up a little bit. Let's say you gave the patient an option between a dental implant and a bridge. Okay, let's just say you have entered in options in your Dentrix treatment plan. You've given the patient the option of a bridge or a dental implant. And let's say those two cases are linked together and you're presenting the patient with options. And let's say now the patient has said yes to the dental implant. Okay, here's what you want to do if this treatment has been accepted. And so now you've helped the patient with the referral. Maybe you're the type of office that you get the oral surgeon on the office phone, you get the scheduler on the phone, you actually help the patient schedule the appointment for the implant consultation. And then, you get them scheduled for maybe a couple weeks from now. And then you let the oral surgeon know, let me know, when the patient is scheduled for the implant surgery. You're coordinating with the specialist and the patient. Then you ask the patient, maybe your office takes a deposit. Great. Our treatment here is going to be $2,500. We ask for a third down. So you get the deposit from the patient and the patient has given you the deposit. Great. I would feel that treatment is accepted. Okay, the patient has scheduled a consultation with the oral surgeon for the dental implant. The patient has given you a deposit for the treatment in your office. They're still not scheduled in your office, but in my mind, they are accepted. They have accepted this treatment. So what you would want to do in your Dentrix software is you would want to accept that case. So if you go up to claim status, go up to case status update. It's the little yellow manila folder. You click on case status and you update the case status as accepted. Now, if you have given the patient those options, those two cases are linked together, it will automatically reject the other case. So it's going to reject the bridge. So that bridge now drops off of your unscheduled list. The dental implant has now been accepted, even though it's not scheduled in your office yet. But in my opinion, that treatment has been accepted. That will help your case acceptance rate on your reports, on your analytics. Okay, so that's one example. Here's another example. Let's say that you are scheduled, let's say you're in the consult room, you're talking to the patient about they need a couple crowns. Let's say they need a crown in the upper right, a couple crowns in the lower right, a couple fillings, and the patient agrees to schedule the single crown in the upper right, and the patient schedules. You haven't asked for any money yet. You're just going to collect on the day of service, but the patient has actually scheduled that crown. Now, in order for you to mark that as accepted treatment, like let's say today, I'm recording this middle of September. Now, let's say the patient doesn't schedule until middle of October. Now, if you just let it ride, if you just let it play out where then that treatment would get completed in October, and then it would get marked as accepted. But if you want to show that that crown that the patient has scheduled has been accepted in September, you would mark that case as accepted now because we're in middle of September. It gets marked as accepted in September. And then when it gets completed in October, then that treatment was already accepted, so it doesn't get accepted again. But that's how Dentrix tracks case acceptance, is either you have marked the case in the treatment plan as accepted, or it's when that treatment gets completed. It's your choice as to when you want that treatment case acceptance number to get updated. Now, let's kind of stay on this example of we have a single crown in the upper right, two crowns in the lower right, a couple fillings on the other side, maybe on the left side. But the patient has focused on, I'm going to do this crown on the upper right now. Now I'm going to wait on all that other treatment. So if you really want your numbers to be as accurate as possible, what you would want to do is take that single crown that is on the treatment plan on the upper right, move it into its own case, like just name it crown upper right, leave the other treatment in that existing case, and then just mark that one case with the single crown in the upper right as accepted. That's how you would really make the numbers work as accurately as possible. Does that make sense? If you're confused, just drop me a line. I can help you out. So case acceptance is either when you have marked the treatment as accepted because it's scheduled, or you've received a deposit for treatment, or the treatment gets completed and then it updates your case acceptance number automatically. Now, let's go back to accepting and rejecting treatment. Let's say, for example, patient comes in for consultation and they need a couple fillings and maybe some SRP, maybe they need some periotherapy. But you also start to talk to them about maybe some aesthetics, like maybe they're thinking about doing some ortho, or maybe they're going to be doing 6 anterior veneers or something. Maybe they're talking about some aesthetics, and the patient let's say that the patient decides to schedule the priorities first, like the periotherapy and the fillings. But then let's say that they've completed all that treatment and now they're thinking about doing the aesthetic portion of their treatment. And you have some ortho or you have some anterior veneers. Now, depending on how long you want that treatment to sit on your unscheduled treatment, it will sit in there as unscheduled, which means that it doesn't move the needle on your case acceptance at all until you actually mark it as accepted or rejected. Now, when a patient says, I'm not going to do that treatment, I've decided I really like my front teeth, I like the way they are, I'm not going to do the anterior veneers, you don't want to just let it sit there. And you also don't delete it. Never, 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 never delete anything out of the treatment plan unless it was a duplicate entry, or if it was a mistake or something like that. You always want to reject treatment. So you want to show it as presented. And then if the patient says, no, I'm not going to go move forward with that, you want to reject that treatment. And then it will reflect more accurately in your case acceptance. I hope that helps. So accept cases, reject cases. And then when you are working through your unscheduled list, which we talked about, a couple weeks ago, you're working your unscheduled list. Then if you reject cases, reject treatment, it will drop off of your treatment manager report. Now, some of you might be thinking, well, Dayna, I don't even know what my case acceptance number is, So the best way to find your case acceptance would be, if you're looking for a report inside of Dentrix, you're going to be wanting to look at the Practice Advisor. The Practice Advisor Report will show you your case acceptance. It's on the very first page, which is the production page. So if you generate your Practice Advisor, and if you're not sure how to generate the Practice Advisor, you can drop me a line. I certainly can help you. Understanding your metrics and understanding your practice numbers is really important for you to make data-driven decisions for your practice, but knowing your case acceptance is really important. So if you open up the Practice Advisor, it's going to show up on that first page, which is the production page. It's going to show up on the very bottom of the production page. So you're going to see a treatment amount diagnosed and a treatment amount accepted. So the treatment amount diagnosed is going to reflect anything that's been added to the treatment plan or anything that has been on the schedule in the past. So if it was diagnosed, it means that it was added to the schedule, that the patient was scheduled for it. So that could also include hygiene. I just want you to know that in Dentrix, the case acceptance, amount diagnosed, and amount of accepted does include hygiene. Now, I wasn't in on that conversation. I wasn't one of the consultants that was in on that focus group that made that decision. I don't agree that hygiene should be part of the case acceptance other than periotherapy, but routine hygiene visits are included in that case acceptance number. So you just have to know that going in. So anything that was added to the treatment plan or was post-set complete today or for the year or the month, whatever date range you're looking at, shows up as that treatment accepted. Okay, so what you'll see on the Practice Advisor is a percentage, and it's a percentage of the amount of treatment that was diagnosed and the amount of treatment that was accepted. Okay, so we talked about how accepted is calculated. Either you have marked the case as accepted or the treatment has actually been completed, post-set completed. So that's how it comes up with that percentage. Now, roughly what we usually see as a dental industry average, we're seeing about 42 to 58% in case acceptance. The higher tiered offices, the top 10% practices, are seeing case acceptance above 75%. So, if you feel like you're an average practice and your case acceptance is 58%, good for you. If you want to increase that case acceptance rate, then look back in some of my previous episodes, learn how to really work that treatment manager report and fill your schedule and reach out to those patients with unscheduled treatment. So I hope this has been helpful, a little tutorial on case acceptance, and I hope you have a great rest of your day. And I look forward to watching your journey of becoming a high-performing dental team.